Maternity question 1. A nurse assists a pregnant client with cardiac disease to identify resource to help her care for 18-month child during last trimester of pregnancy. The nurse encourages the pregnant client to use this resource primarily to 1. Help the mother prepare for labor and delivery. 2. Reduce excessive maternal stress and fatigue. 3. Prepare the 18-month-old child for maternal separation during hospitalization. 4. Avoid exposure to potential pathogens and resulting infection. The correct answer is 2. Reduce excessive maternal stress and fatigue. 2. A client in labor has been pushing effectively for 1 hour. The nurse determines that the client's primarily physiological needs at this time to 1. Change position frequently. 2. Ambulate. 3. Consume oral food and fluids. 4. Rest between contraction. The correct answer is 4. Rest between contraction. 3. The nurse is teaching a diabetic pregnant client about nutrition and insulin needs during pregnancy. The nurse determines that the client understands dietary and insulin needs if the client states that the second half of the pregnancy may require 1. Increased caloric intake. 2. Decreased caloric intake. 3. Increased insulin. 4. Decreased insulin. The correct answer is 3. Increased insulin. 4. A home care nurse visits a pregnant client who has a diagnosis of mild preeclampsia and who is being monitored for pregnancy-induced hypertension. Which assessment finding indicates the worsening of the preeclampsia and the need to notify the physician? 1. Blood pressure reading is the prenatal baseline. 2. Urinary output has increased. 3. The client complains of headache and blurred vision. 4. Dependent edema has resolved. The correct answer is 3. The client complains of a headache and blurred vision. 5. A client in labor is dilated 10 cm. At this time during labor, the nurse would plan to assess and document at the fetal heart rate at least 1. Before each contraction. 2. Every 15 minutes. 3. Every 30 minutes. 4. Hourly. The correct answer is 2. Every 15 minutes. 6. The nurse in the prenatal clinic is providing nutritional counseling to a pregnant client. The nurse instructs the client is increasing the intake of folic acid and tell the client that which of the following food items is highest in folic acid. 1. Chicken. 2. Pork. 3. Cheese. 4. Green leafy vegetables. The correct answer is 4. Green leafy vegetables. 7. A nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetic mellitus. Which statement, if made by the client, indicate a need for further education? 1. I need to stay on the diabetic diet. 2. I will perform glucose monitoring at home. 3. I need to avoid exercise because of the negative effect of insulin production. 4. I need to be aware of any infection and report signs of infection immediately to my healthcare provider. The correct answer is 3. I need to avoid exercise because of the negative effect of insulin production. 8. A nurse is caring for a client in the second stage of labor. The client is experiencing uterine contraction every 2 minutes. The cries out in pain. With each contraction, the nurse recognizes this behavior as 1. Exhaustion. 2. Fear of losing control. 3. Involuntary grunting. 4. Valsalva maneuver. The correct answer is fear of losing control.